Hello, everyone. My name is Lila Vicente, and I am a health educator within the Native Challenge Department. The Native Challenge Department services Native middle school and high school youth ranging from ages 12 to 19. We work for Riverside, San Bernardino County Indian Health Incorporated. Today, I will be presenting on COVID-19, and on a later date, Dr. Farah, our medical director, will be joining us. So, what is coronavirus? At this point, we've all heard coronavirus at one point or another. We've also heard it being called COVID-19. So, COVID-19 is an illness caused by a virus that can spread from person to person. Symptoms can range from mild or no symptoms to severe illness. So, the word COVID-19 also stems from CO, meaning corona, VI, meaning virus, and D, meaning disease. And also, the 19 will stand for the year that it was discovered, basically. So, coronavirus disease 2019. Who is at higher risk for serious illness? Smokers, adults 65 and up, individuals with compromised immune systems, individuals who have serious chronic medical conditions like heart disease, diabetes, lung disease, also high blood pressure. And heart disease, diabetes, and high blood pressure are all common medical conditions within our Native community as well. COVID-19 is spread. So COVID-19 is spread from coming in close contact with a person who has tested positive with COVID-19. When an infected person coughs, sneezes, or talks, respiratory droplets are released into the air. Touching a surface or object that has the virus on it, and then touching your mouth, nose, or eyes. So there are many symptoms of COVID-19. Some included are fever, chills, fatigue, shortness of breath or difficulty breathing, cough, muscle or body aches, headache, new loss of taste or smell, nausea or vomiting, sore throat, congestion or runny nose, and diarrhea. So the mild symptoms are the manageable ones that you can isolate yourself. Worsening symptoms, you would continue to isolate yourself and consider telehealth or nurse line. And for severe symptoms like trouble breathing, persistent chest pain or pressure, confusion, inability to wake up or stay awake, and bluish lips or face, call 911 and tell the dispatcher your symptoms. So please consult your medical provider for any other symptoms that are severe or concerning. COVID precautions and guidelines. So, social distancing, we've all heard that before. Keep a distance of 6 feet between others. Hand washing, wash your hands for a minimum of 20 seconds with soap and water. Masks, which lessen the chance of airborne particles being spread. So, just make sure you're doing all those three things if you're ever out and around people that don't live in your household, just to keep yourself safe and other people safe. You'll just want to constantly be doing these three things. More on social distancing. So, quarantine. The most effective way to social distance is to quarantine. Most services, such as groceries, pharmacies, doctor visits, and banking, is available online now. Limit in person contact as much as possible and opt for deliveries or takeout services. So that's why you always see all the restaurants now, they're doing like carry out. You just give them a call, and then sometimes you can just pull up to the front, give them, and then let them know that you're there and your food's ready to be picked up and taken home. I know at our RSBCIHI pharmacies, you guys give them a call, and usually you would go in and sign for it, but now they have different standards in place to help make it safer for everybody, and they'll bring your medications to you outside, and that's specifically for our Riverside, San Bernardino County Indian Health pharmacies. I know we're offering doctor visits more, telehealth type visits, and there's just more options given the circumstances that we have to deal with now to limit our in-person contact with people. And when we do have to be in public, we must make sure that we are staying at least 6 feet away from each other and wearing our mask. And that's just to prevent any other airborne droplets to end up on us and infect us if that is So hands should be washed with soap and water for at least 20 seconds when visibly soiled before eating and after using the restroom. I know a lot of people like to wash their hands prior to doing anything that they think they might be touching something for a long time. Like I like to wash my hands, for example, before I start typing or I know I'm going to be on my computer for a while just so I can keep my work area as clean as possible and then making sure I clean that area afterwards. So this is a photo to represent the effectiveness of hand washing. Each of the 6 photos shows how much bacteria was on a woman's hand using blacklight and a cream called the glow germ, which is a mineral oil that clings to germs and is only visible under a UV light. So you can see in the first photo how her hand is basically glowing with the light illuminating it. And the second photo shows her doing a rinse and shake. So just really quick, wets her hands and shakes her hands dry. 6 seconds with no soap, so just water and a quick rinse under the sink, and 6 seconds with soap. And you can see how effective that 6 seconds was in taking off the glow germ. 15 seconds with soap, and you can see that between her fingers doesn't have too much glow germ around there anymore. And then 30 seconds with soap, you can see that the glow germ is not on her hands at all, really. And like the only part that is glowing is her fingernails. And that's probably just because the fingernails are a different type of texture than the rest of her hand. As for hand sanitizer should only be utilized when soap and clean water are not available for hand washing. A final concentration of 80% ethanol or 75% isopropyl alcohol is recommended. And also keep in mind that hand sanitizer becomes ineffective after 5 applications, and you should wash your hands thoroughly as soon as possible. So hand sanitizer is for like those situations where you can't find a sink and clean water. Like for myself personally, I try to use gloves when I go to the gas station. And if I don't have any available at the time, then I will use hand sanitizer and make sure I'm not touching any surfaces that I'll be touching in my car if I have to touch that handle. So wearing a mask not only protects other people, but also the person who wears it. Cloth masks are not medical grade, but they may be helpful in non-patient settings to contain coughs and remind people to not touch their face. So we see people wearing masks all the time. We're required to wear them at work all day. The only place really that I don't wear a mask is at home. Um, but just make sure that you're trying your best to keep yourself and others protected by wearing your mask whenever you're around somebody that's not in your household. And here we have a quick video, about a 20-second video from the Gurney Room. And it's basically a cough simulator. So COVID-19 is spread through cough droplets. So what if you could easily see them? They built a cough simulator to demonstrate how a mask helps prevent COVID spread. We set up a pressurized tank and use a sprinkler valve to release the pressure and at the push of a button. We dyed the water with a non-toxic fluorescent dye and loaded it into the mannequin's mouth. We set up an ultraviolet light so that the droplets would be more visible to the naked eye, and a volunteer stood 3 feet away from the simulator as the droplets were expelled. The top video shows how droplets are spread without a mask on the simulator, and the lower video, they masked him up and no droplets showed up on the volunteer's mask. So this kind of just gives you a um, idea of which situation would you rather be in. Would you want to be close to someone that sneezes or close to someone that has a mask on and sneezes? And ideally, in a perfect world, people do cover their mouths as well. So, and here is a checklist for school administrators, teachers, and staff. So we want to promote and demonstrate regular hand washing and positive hygiene behaviors and monitor their uptake. Ensure adequate, clean, and separate toilets for girls and boys. Ensure soap and safe water is available at age-appropriate hand washing stations. Encourage Frequent and thorough washing at least 20 seconds. Place hand sanitizers in toilet rooms, classrooms, halls, and near exits where possible. Ensure adequate, clean, and separate toilets or latrines for girls and boys. Clean and disinfect school buildings, classrooms, and especially water and sanitation facilities at least once a day, particularly surfaces that are touched by many people, such as railings, lunch tables, sport equipment, door and window handles, toys, teaching and learning aids, etc. So using sodium hypochlorite at 0.5%, equivalent to 5,000 ppm for disinfecting surfaces and 70% ethyl alcohol for disinfection of small items, and ensure appropriate equipment for cleaning staff. Increasing airflow and ventilation where climate allows, such as opening windows, using air conditioning where available, etc., etc. And posting signs encouraging good hand and respiratory hygiene practices, and ensuring trash is removed daily and disposed of safely. So all five of these things are things you guys can do within a school setting for teachers and staff. So, with people being stuck at home, domestic violence and child abuse has risen, unfortunately. So, here are some ways that you can recognize the signs. So, unexplained or repeated injuries, behavioral extremes, poor hygiene, untreated illnesses or injuries, unusual school attendance, lack of basic necessities and knowledge. And what can you do? So, in case of an emergency or if a child indicates that they are afraid to return home, you should call local law enforcement immediately. In other cases, contacting the appropriate Child Protective Services agency, which is determined by the county in which the custodial parent or guardian resides. So those are just two things you can do to help limit and assist and help those people that are suffering from domestic violence and child abuse during this time. So dealing with grief. With COVID numbers rising and falling and rising again, there have been plenty of people that have lost their lives to this disease, and people have been experiencing grief beforehand and after. So, there is this thing called anticipatory grief, which refers to a feeling of grief occurring before an impending loss. Typically, the impending loss is the death of someone close due to illness, and that's knowing that someone close to you is about to be gone soon and there's nothing you can do about it. So that's just you feeling that type of sadness whenever you're around them, because you know there's nothing you can do to help them, and you know that sooner or later that they won't be in your lives anymore. And so that's what anticipatory grief is. As for disenfranchised grief, that's any grief that a society or part of it doesn't expect, openly acknowledge, or allow people to express or publicly mourn. So when people talk about COVID, it's somewhat looked down upon. Like there's a lot of non believers, people that have their own viewpoints about everything and all of it. And because like a lot of people have passed from it, um, it's not recognized the same way as an accident, for example. So disenfranchised grief is something that is minimalized and may not be understood by some people. So, just because someone passed from COVID does not make their death less relevant or tragic than someone dying in an accident, as I had said. So, that's just like an example to give you an idea that loss is loss and it's going to hurt no matter what. And people shouldn't have to feel alone and deal with that on their own. So, mental health is an important part of overall health and well being. It affects how we think, feel, and act. It may also affect how we handle stress, relate to others, and make choices during an emergency. So, self care is very important during this time. So, this is being mindful of your own needs so that you're able to support the people you care about, knowing who you are and your limits, making sure that you're protecting your own well being and happiness, particularly during times of stress. And that's basically taking care of yourself so you can take care of Maybe you have to take care of your parents or your elders. So you want to make sure that you have enough energy and you're not going to get drained out from putting other people before yourself. So that's what self care is. Mindfulness, which is a meditation technique where one focuses on their awareness on the present moment. So being able to acknowledge and accept one's feelings, thoughts, and any sensory sensations. So these are two things that you can do to help promote your own mental health. Self care is very important to myself. Some examples are like exercising, playing instruments, or maybe even like just treating yourself to certain things. Maybe you like plants, you like to do yoga, sew, cook. Those are all things that like make you feel happy. Those are things that make you feel balanced and centered when everything else is going wrong. You can always turn to those things to make you feel better. And mindfulness, like when I'm in times of stress and I have a lot of things that need to get done and I'm just kind of overwhelmed, like what I like to do is just take a moment and I have my Apple Watch and it tells me, it has like a breathing app and it just helps me like just calm down from whatever I'm feeling and recenter myself so I can come back to work and be productive. So, coping with quarantine. So, we talked about practicing self care and mindfulness so that you can proactively take care of others, knowing where to get immediate help in crisis. So, if you need help and you're maybe feeling suicidal or your mental health is declining, you can call 800 273 8255. Let me repeat that, 800 273 8255. And that will connect you with someone that can help you through whatever you're dealing with in that at that point in time. And if you're not comfortable with calling, you can also text home, HOME, to 74741. And that will connect you with a 24/7 mental health support line. And once again, let me repeat the text line to you, which is home, HOME, to 74741. I just want to make sure that you guys have some resources available. And also, we have people on call in our behavioral health services if you need to talk to someone as well. There's always a doctor available if you call the Indian Health lines after hours. And connecting with others in your community or connect culturally and spiritually. So those are things like sweat, beading, dancing, singing, basket weaving, just to make yourself feel culturally connected to your culture once again. That can always help with any stress that you might be feeling. And always remember that everyone deals with stress differently. Keep in mind that everyone has different coping mechanisms based on their support systems, financial situations, community they live in, and health and emotional backgrounds. And throughout everything, just remember to remain resilient. Resilience is being able to overcome any challenges that have come in your way. Like the image right here, this man has so much things. It has the coronavirus showing that it's trying to push him down, but he's remaining resilient and trying to push back towards the coronavirus just to show that he has enough strength within himself to stay focused on what he wants from his life. He wants to stay alive. So that's like kind of find the meaning in adversity. So through all of this, there have been so many downs, but there have also been some ups for some people. I've seen people that were struggling before quarantine, and now that they have been in quarantine, some people have created businesses and they're thriving from their new businesses. Some people lost their jobs and were able to create a job online to feed their families. So you just have to find ways to combat all these negative feelings that are being pushed towards us. And that's also adapting to the new normal. Like it really sucks that we have to wear masks. I can get behind that. But it's something that we do to help others and just help the community and help keep numbers down. So I have so many different masks. I have disposable ones, I have reusable ones, and they're all um, thick type materials. And I'm allowed to, I'm able to mix and match them with my different outfits. They have different styles. So you can kind of find like your personality, and it's like I see it as a new accessory. And also, while you can't control the situation, you can control how you respond. So although it's been rough throughout all of this, I always believe that it's going to end eventually, and there's no need to get upset about it and let it weigh down on you. And discovering new ways to connect with loved ones, such as video calls. So I remember when quarantine first started, I was like FaceTiming with my friends every few days, and I hardly talked to my friends that much to begin with, but I don't know, just knowing that we had to be inside all the time, we were calling each other constantly, so it helped me reconnect with a lot of my older friends and whatnot. And take it one step at a time, and make sure to reach out if you're ever feeling overwhelmed. You don't have to do any of this alone. A lot of us are having the same feelings that you're probably having, but just being comfortable enough to talk to somebody, like maybe even your friend, and like if you're really feeling bad, you can always find a therapist or a counselor of some sort to help you get through that. But you're not alone, and a lot of people are feeling the same emotions that you are. Here are some myths and facts. So here's a common myth. Hand sanitizers contribute to antibiotic resistance. So, and the fact is, alcohol-based hand sanitizers do not contribute to antibiotic resistance. Instead, they kill germs, including antibiotic resistant germs, by destroying the proteins and breaking down the protective outer membrane that germs need to survive. Another myth is that you can get a face mask exemption card so you don't need to wear a face mask. The fact is that the United States Department of Justice issued a statement explaining that these cards and flyers are fraudulent. So everybody that's trying to get around it and say that they don't need to wear a mask and they have paperwork, they're just downloading nonsense from the internet probably. And a myth is ordering or buying products shipped from overseas will make a person sick. The fact is, the WHO says the likelihood of a person becoming infected from a package is low since it has likely traveled over several days and has been exposed to different temperatures and conditions during transit. And here are some book recommendations for children. There's Coronavirus, a book for children. Bray Bray Conquers the Coronavirus. Why We Stay Home. Susie learns about coronavirus. We're going to be okay. My Hero is You. And What Color is Today. So these are all books we found online, and they are free, so you're able to download them in a PDF format. And if you're trying to talk to your kids about coronavirus and you're not sure how to go about that, these books can probably help you. And they have a lot of images to keep the children engaged. And here are the links for those books. And time for some stats. So as of September 15th, 2020, there have been 760,013 total cases reported in California. And this is via the California Department of Public Health. And here is a little graph to give you guys a visual representation of the numbers that have been reported as of April to now, which is September 15th, 2020. So the whole United States has reported 6,537,627 total cases as of September 15th, 2020. And of those 6,194,092 have passed. And within the last 7 days, 250,265 as of September 15th have reported to have tested positive. And here are some graphs explaining the proportions of cases of American Indian or Alaska Native in California. So on the left graph, you can see that the different colors represent different age groups, and the left side of that specific graph has the number of cases reported looks quite high, but the number of deaths all remain under that 50-person count. And here we would have a question and answer section with Dr. Farah. At this moment, he is not joining me on this, so if you would like your questions answered by our medical director, you could forward them to us and we could find a way to get it to him. Thank you guys for joining me on this COVID presentation. If you have any questions or concerns in regards to this PowerPoint, please feel free to reach out to us at ccg@rsbcihi.org or 951-849-4761. Also, if you guys could follow our social media accounts, we would greatly appreciate it. We are on Instagram, Facebook, Snapchat, and Twitter. And our handle is Native Challenge on all of them. And here are the references we used to create this PowerPoint. And the resources we used to create this as well, such as the CDC, Center for Disease Control and Prevention, CTEC, California Tribal Epidemiology Center, the WHO World Health Organization, the California Rural Indian Health Board Incorporated, Riverside University Health System of Public Health, San Bernardino Public Health, California Department of Public Health.